Hi, I'm Dr. Toby Moma, your host on Health and Wellness with Dr. Toby. What a privilege to invite you to watch my show this week. We have some distinguished guests, Dr. Craig and Liz Comachi. Dr. Craig has his theology doctorate from Hope Bible Institute in Baton Rouge, and he has his bachelor's from Chesapeake Bible College in Maryland, and he's going to be sharing with you this heart for Mississippi, for Louisiana and the area around here. His wife is a registered nurse at the Ochsner Hospital, works in the registered nurse department with obstetrics and gynecology, and she's been doing this for almost 30 years. You don't want to miss their insight on marriage, on ministry, on raising children, on medicine, on how she has worked hard to get to where she is now, and how he, after having a life in prison, a life outside the home, a life with no father, a life with drugs and alcohol, came back and obtained a PhD within an 8-year cycle. It's a testimony, it's a story you don't want to miss. Don't forget to join us on this show. God bless you. Jesus is Lord. What a delight to have you on our show. I'm Dr. Toby. I'm a family physician at the University of Mississippi, and I'm honored to have you on my show. I've been talking with two delightful guests, Dr. Craig and Liz Comachi. Liz is a nurse. I've known her for a couple of years, and she works at the University of LSU, Ochsner System, Conway, as a registered nurse in the OB department. Dr. Craig, I just got to know. He's the founder of Good News Counseling. He's the pastor at Good News Ministries, and also the principal at the Rema Leadership Institute. He's a multi-talented individual. He worked at Bancroft Bags. He does counseling, licensed professional Christian counselor, and now he's in ministry and even doing as well counseling and helping people who need rehab training and all that, rehab out of prison or drugs and all that. So they've been sharing their heart with me, and it's been such a delight, and I've just enjoyed having both of them on the show today. This is a couple that was made between West Monroe and Monroe. So it shows us that there's still great people that come out of these two great cities. And we're so delighted that they've chosen to settle here in Monroe and make a family and make a ministry and make God's name great in this part of the country. So we were talking earlier on about the mortality rate in America, maternal mortality rate. Liz works at the OB clinic. I just wanted to ask Dr. Craig, I asked this question earlier. I said, are there particular let me use the word psychosocial indices that are responsible for the high mortality, maternal mortality in African American females? When I say psychosocial indices, I mean, is poverty a risk factor? Is single parenthood a risk factor? Is a lack of education a risk factor? How come we see a 3 times higher maternal mortality in African Americans compared to Caucasians in the same United States? And like Liz will tell you, every woman gets medical coverage for insurance once they get pregnant. It's a given. So it's not because of lack of insurance. I don't know why we still have this diverse demographic outcomes when you talk of maternal mortality. Do you have any reason for that, the psychosocial indices that might be responsible?
Yes, it's education. And I say it, education. Because that covers a lot of facets of a person's life. When you have an education, it gives you the ability to learn about things you should do as far as your health, right? As far as your mental well-being. And it also gives you an opportunity to earn a higher pay or wages than anyone else. If you want to eat healthy, right, it's going to cost you a little bit more. Even if we're talking about water, I often talk to people about water and try to get them to drink water that has a high alkaline content. People will ask me, well, what's the difference? And you paid $22 for that case of water, but this one here costs $3. I says, exactly. If it costs $3, right, and this one costs $22, then there's a difference that what's in the water, the minerals that are in the water, versus the one that's in it, that's in that water that costs $3. So it's a difference. So what we have all these issues have become compounded. So we have a person, we have people who are using alcohol and drugs. The people aren't eating healthy. Poverty is there. They're worried and stressed out about paying their bills. So you're dealing with some mental health issues that, to begin to be, bombarded in there. We just begin to squeeze all of these things in, and it's simply because of a lack of education. Right? So when we can give people, and I'm not just talking about going to a school, going to college, I'm talking about training and skills, welding, barbering, cosmetology. We have got to do a better job of
helping the
African American communities in becoming professionals.
Right.
You can be a professional without going to a 4-year college, right? So we have to begin to do better in training our people to think and to kind of trust your instinct and your purpose and what you're good at. If you're good at something, if you're good at drawing, right? If you're good at sewing clothes, if you're good at designing, if you're good at wedding planning, to throw all of your eggs in one basket and develop your craft, right? And we don't do that. We don't do that. We want to send our children to these schools, and sometimes sending your child to a school where they end up $40,000 or $50,000 in student loan debt, right, into a profession that they really don't love. I'm going to say this. I know people right today who have gone to college for 4 years, 6 years, and they're in professions that they hate.
That's right.
Right. And they're thinking about doing something different.
They have a loan that they just disgusted when they think about it.
Right. And so we don't want to do that.
Right.
We don't want to continue to perpetuate an idea that you have to do it this way in order to be successful. We should give our people outlets, and then of course keep them away from the things that's going to be not healthy, like the drugs, the alcohol. Don't bring those things in the home. Children are not going to do what you say. Children are going to do what they see you do. If they see you do these behaviors, then they're going to do.
Do you think it's true when people say, oh, it's the food? People say African Americans have a poor mortality rate because of the food they eat, because of what their parents showed them. They've taken that food and they've, pig feet and pork chops. And I mean, that's what I hear a lot. And they say, oh, that's how they perpetuated unhealthy lifestyles.
That is correct.
Is it really true, or it's just a myth?
No, it is actually true. It is actually true. It's in the diet, right? It's in the diet. If we could go back and undo those thinking patterns and behavior patterns of how people, the African Americans, have been trained to eat, we would bring down high blood pressure. We would bring down sugar diabetes. We would bring down some of the liver, Yeah, we would bring those chronic illnesses down where people are having to take medication on a daily basis. When I do an assessment with an individual, I start off asking these questions like, how many times have you been hospitalized before in your life? And they'll answer, okay, do you take medication on a daily basis? Yes. For what? I'm always getting these two answers: hypertension or high blood pressure and sugar diabetes. So there's a common thread, right? So when I begin to when I look at this, what a race is this prominent in, right? So so the statistics are there, so people can't ignore and say, okay, this is just a myth. No, it's not a myth. It's real. This is actually what's going on. We don't eat right. I say this all the time. I stay away from bread. I don't eat it. I mean, very little, right? I got away from the white sugars.
That's
Right? I got away from it. I love sweets, but I had to get away from it. Once I watched the videos and got the training and began to see this is what this causes.
Education,
too. Education. This is what this causes. This is what this causes. And so you stop it. But we don't eat healthy because we don't have the money. My wife and I, we know we're fortunate to be able. Well, we can go pay $20 for a case of water. It's
So
not going to
it's
bother
cheaper
us.
to eat unhealthy. It's cheaper to buy uh, honey
Correct.
buns. And
Correct. Correct. So if I got clients that get $783 a month SSI, right? They pay their little rent. They get $200 worth of food stamps. They're trying to make it stretch.
That's right.
So they can't afford to buy
Groceries
organic and asparagus and
right.
zucchini
They're
and
gonna
lamb.
They're
They
gonna
got to get
the
pork chops,
quick
bacon,
ones,
the
yeah.
cheap water, right? And as a result, they have medical problems.
Wow.
And I can just say for myself, even, when I was eating breakfast at work in the cafeteria, I had gotten to where, I was trying to eat healthy. So I would, go to the cafeteria and I got for months that I was eating yogurt every morning and put the little, granola sprinklings on top, put fruit and everything. And sometimes I would pay, no, not sometimes, depending, they were weighing it. So
Right.
they'll put it on a scale, and I'm paying 4 or 5, depending on how much you put on there, $6. And I'm like, for some yogurt that I'm going to still be hungry when I finish. Versus, Dr. Moma, I could get what they call a toaster sandwich, which consists of some bread that they've slopped in butter, egg, meat, and cheese for $2 and something.
Wow.
And I'm like,
In the same cafeteria?
in the same cafeteria,
Oh.
I can get a sandwich that has meat, egg, cheese, and bread, and pay $2 and some change, versus trying to eat healthy with this yogurt with granola sprinkling with fruit, and I'm paying five,
And
6.
actually,
and so,
the number one reason for mortality in pregnant women in America is high blood pressure. That's the number one reason. Cardiovascular disease. And most times it's tied to body mass index.
Yes.
The bigger they are, the more high risk they're going to have high blood pressure,
and
diabetes.
diabetes.
So you always end up having to do a C-section because it's a difficult delivery when you're 300, 400 pounds. So
Wow.
it's almost a vicious cycle. That's high blood pressure, diabetes, obesity. So if you change the diet, you may change the obesity, then you may change the blood pressure, then you may change the high blood pressure. So it's like,
Right.
so we should start with education and diet and all
That's
that.
correct.
You know? So, Liz, I want to ask you, what would you tell a pregnant woman sitting in front of you if you were, what's your first counsel for a newly pregnant patient? She's never been pregnant before. She's a teenage mom. She's never experienced this before. Her boyfriend is not supportive. She's going to take care of this baby. She wants to take care of this baby. And I'm talking from a medical perspective because there are patients, there are viewers watching me who are single moms who want to know what next step to take.
I would definitely encourage that mom to attend prenatal care. Her prenatal care, come to see her provider, is very important. At some point, during my nursing career, I worked with Nurse Family Partnership, which was, we had registered nurses that went to the homes of first-time. So this program was geared towards first-time moms. And it was educational, and also, we helped them with, psychosocial or whatever, things that they needed in the community. But the biggest part was education. But I would encourage them to prenatal care and prenatal providers, because a lot of times they're getting information from their parents or whoever else that's incorrect. And so that just continues. Well, my mom told me, or my cousin told me, or my sister said, and the information is false. And so they need to come to their visits so that they can get the proper education. I would encourage them, to most OBGYN facilities have prenatal childbirth classes.
Okay.
So they can be educated on what to expect during the childbirth encounter, from the time they come to the labor and delivery, and what to expect afterwards. So I would just encourage them, make sure that you see your provider. They're going to keep up with what's going on with your baby, what your lab work is looking like. You're going to get ultrasounds that's necessary. So, we've had, diabetics who have delivered deceased babies because they did not, they were non-compliant with their prenatal care. They did not keep an eye on their sugars, and it's very hurtful for us as healthcare providers, because I can personally say that I can remember several instances where a female has gone to her third trimester, full term, 36, 37 weeks, and end up what we call IUFD, intrauterine fetal demise. The baby died. Just a couple of weeks ago, I had a mom to call me called the clinic on the phone, and I answered, and she said that she hadn't felt a baby move in 2 days, and I'm like, well, look in the chart, see how many weeks she is, and I'm like, well, has your baby been active prior to, now? Yes, baby been active, and I said, well, I would advise that you come to the labor unit right now. If you have not felt your baby move in 2 days, I advise you to come to the labor unit, IUFD. So, be compliant with your health care provider. They're not steering you wrong. They're only there to help you. You have to have a trust relationship. So if you're going to a healthcare provider that you don't trust, there are several houses
you have options.
Healthcare. Yeah, you're right. You have options. So go somewhere where you trust, but definitely don't let one healthcare provider prevent you from getting the necessary medical management that you need for you and your unborn child.
Awesome advice, Dr. Craig. I want to ask. This is a controversial question. I'm going to say before I ask it. A lot of people have said the African American female community sometimes looks at pregnancy as a paycheck, as a way to develop a source of income. Is this a myth or is this a reality? And if it's a reality, when did this become a norm? I mean, is it true that there are girls who actually have children to develop a means to financially stay?
Yes. Yes. It's unfortunate, but yes, it's true. I know of people specifically who have reared women, who have reared their daughters to think in these terms, that a way out is get pregnant, be able to, you're going to apply for food stamps, you're going to try to apply for a check, you're going to go to the housing authority, you're going to get you a house. You're going, and the more children you have, the more stamps you're going to get. I know of families where this cycle has been perpetuated at least 3 and 4 generations, and still that mindset is still prevalent and working in those particular families.
So this
to
girl,
this day.
she doesn't go to college, obviously, because she's too busy with having children.
No, this is when we take it's education, because people only are going to do what they think. As my wife said, that sometimes these young women, they sit around and they hear what mama said, what auntie said, and such said, and such said. That's concerning childbirth. They also do the same thing when it comes down to relationships and life and just living experiences. The young ladies are witnessing or sitting around hearing their mothers and their aunties and their relatives talk about how to get out of poverty or the ghetto or the projects, and how you go about getting your own house and your own apartment. And they sit around and they tell these stories and they tell these tales. But and this is what they have done actually in order for them to get out. Right. So it's a mindset that is perpetrated, and it's prevalent. It's real. So yes, it's not a myth. It's real, and you try to get people out of that. In other words, my mom calls it this. My mom is an educator. My mom calls it always trying to get something for nothing. Right? And so you run into people that they want the reward on this side, but they don't want to do the work on this side in order to get their life to this place. So they will take any shortcut they can, right, in an attempt to have that type of life without actually putting in the work. And it's even if it resorts to some type of, criminal behavior.
Well, your mom went to college,
Of
even though
course.
she had you in
Right.
high school.
Yes.
So those girls, I'm trying to put it in perspective here. Is it possible for them to get the food stamps and still remain in college? No.
Well, yeah,
I mean, it's possible,
if-
but
if you-
it's hard work.
But that's what help is.
Right.
And I always tell people this, and I provide help to some people. If you need help, I'll help you. But help is not a permanent crutch. Help is temporary assistance. And a lot of people have leaned on the help crutch, and they've remained on that crutch 1 year, 2 years, 3 years, 4 years. It's 5 years later, and you're still on the crutch.
same crutch.
So I'm a proponent of once the government provides a certain type of assistance for a certain amount of years, then I think that there needs to be some accountability to say whether or not you're progressing. If there has been no diagnosis, if there's not a diagnosis given to that person where a mental health diagnosis or for a physical problem, if you have not been deemed permanently disabled or permanently, you got a mental health situation that can't be corrected, that's fine. But we need to begin to push these people through programs that's going to hold them accountable so that they will get better with it. They don't lean upon public assistance their entire lives, because we got this going on. So I don't support that type of stuff. Now, I get a lot of flack back, but you can, it is what it is. I believe that if you're able to get up in the morning and go to work, you're able to go to school, you're able to pay your bills, I don't believe that the government should be taking care of you.
Because the Bible says if you do not work, you should
Then
not
eat.
eat.
You should
So
eat.
here we are promoting giving money, and
Right.
so why would they go to work if they can get I don't know if it's a
You don't have to eat, don't have to
That's
work.
right. That's right. They're not going to do it.
So let me talk about Liz. So when you went to nursing school at Votech, was there an option to just sit at home? Did your mom give you that option? I mean, you never heard that option, have a baby, get a check. That never came
No,
across your table.
no,
So
my-
that wasn't even on the discussion
No,
in your home.
never.
So it's all about the environment these
Yeah.
girls
Yes,
are
sir.
raised in.
Yes, sir. That is correct.
So when you were in high school, you knew you were going to a, let me use the word tertiary educational institution, somewhere to progress.
Correct.
You were never going to just plateau or stay where you were. You were going to go forward.
Yes.
Right.
Correct.
And you chose Votech obviously because you wanted to do nursing. It was within easy affordability, easy accessibility.
Actually, out of high school, I went to my dream school. I always wanted to attend Louisiana Tech University. So out of high school, I did my first year. I went to Louisiana Tech.
Oh, wow.
But I was homesick.
Really?
And so I...
30 minutes away.
Yeah.
That's all.
I told you a little bit how I was. I was sheltered and didn't know a lot of people. And so I had my own vehicle, so I can remember one weekend staying on campus during that year at college, and that was Gramblin's homecoming. And that Sunday, I wanted to drive home and come back, and actually got to a point where I wouldn't come back to college until Monday mornings.
Really?
Yes, so I went to Louisiana Tech for a year, and then I went to Votech and did it the LPN way, extension, and then, eventually over the years, start back gradually taking classes.
So let me
courses.
throw out another wrench here. When you had Christian, was there ever a thought or a temptation in your mind to, I can stay at home, get a check, because Christian is my dependent?
No,
And-
never. You don't even have to finish that. No,
Because
not
that's
ever.
what
I've
happens
always been an
today.
independent person. I personally have always been independent. My mom kind of was responsible for that.
But you've heard of mothers who do that.
Oh yes,
They put
that's
their career
not.
on the hold and they just get a check for taking care of the
Hey,
son
the
or
check
daughter.
wasn't going to be big enough for
It's
me.
not. It's never going to
Never
be.
big enough for me. So I can't sit back and depend on somebody else to take
So
care
it's
of me.
all about the environment the person is raising, because here she is saying she never thought about it, but I personally had a nurse in my practice when I was in Arcadia who stopped working for me. And she said the reason is because if she earns above a certain amount of money, she will not qualify for this check that helps her son or daughter go to a particular, they call it I think this kind of school. But if she earns a certain, so her son gets this scholarship because of the amount of money she earns. So she said, I'm going to stay at home so I can qualify for this benefit. That's what she told me. And she quit working as a nurse. She went to stay at home just to support. And I was like, okay, the problem I had with that was that her son was going to see her at home every day, and he would think that is a suitable way of life. And obviously, this is 10 years later. I don't know how she turned out, but I think it makes a difference what the children see every day. If they see the parents going to work every day, they say, "Oh, this is something important."
Yeah.
But if they see the father wake up, turn on the TV, the mother get out the juice, and they're going to think life is just, there's no need to go to work on a regular basis.
Right. And this is what has perpetuated that idea, those ideologies in our neighborhoods and in our communities. This is what they see. So you're correct. No father's in the home, but the mother is there. And the kids wake up going to school, but mama don't go nowhere, right? So mom is getting the food stamps, mom is getting the check every month, and the kids see this. So when the kids start smelling themselves, they want their own place. So the way they can get their own place, let me have Mill's child or two, then I can get my own house. And this is what's going on. This is how this is going. Liz and I, we have been telling Christian, and he's a senior, but we've been telling him probably for the last 2 years. You better be thinking, boy, because you're going to do something. But we are preparing him.
Of course.
This is what's coming up. This is what's coming up. This is what's coming up. My daughter is 30 years old, and I just married her. My wife and I, we flew to Orlando last month.
October.
In October, and I married her.
Oh, wow.
Her husband is a sergeant in the military.
Praise
And
God.
but I was telling her 2 years ago, I was like, listen, you stop going to school and you working on these jobs. These jobs paying you $10 an hour, $12 an hour, sweetie, that ain't no money. Right? If you got to ask somebody about an hourly salary, you in trouble. Right? Hey, you need to go back to school.
And get a career.
That was 2 years ago. So guess what my daughter's doing? At 30 years old, she realized, Daddy, you're right. I'm going back to school.
Wow.
You see? Because in order to get somewhere in life, the type of life you want, you got to get it. And that was one of the things that really impressed me about my mom. And this is what kind of just dawned on me, My mom said to me one day, she says, Craig, she says, son, I don't understand you. She says, Craig, I have problems. She says, everybody in life has problems. She said, but I don't smoke no dope to make my problems go away.
Wow. That's powerful.
And I looked at my mama. when she said that to me, I'm late 30s, early 40s. So I look at my mama, and here was the thought I had. That's a woman telling you that she know how to suck it up and go to work. So I heard this say to me,
It was a reality check.
you need to suck it up and go to work.
It was a reality check. Friends, we've been talking with Dr. Craig and Liz Comanche. We've been honored, delighted, and privileged to have them on our show. Check us out, faithandpower.online. Join us. We have our Holy Ghost Night, January 29th. We're going to have Minister Lewis with us from Heavenly Travelers Ministries, 11 p.m. at the Oyo Inn on 165, 11 p.m. Friday night to 4 a.m. We're looking forward to seeing you. Join us. Don't forget, Jesus is Lord. God bless you in Jesus' name.